Good morning, everyone. Today we are going to discuss the pleural fluid analysis. Now, the pleural fluid, like to understand what is pleural fluid, you must have the concept of what is pleural cavity. So, pleural cavity is a space between the parietal and the visceral um, layer um, around the lungs. And what is the function of this pleural space? Because, like in this one, there is a small amount of fluid is present which serves as a lubricant or to decrease the friction because the lungs are in continuous motion. And if you will see the mechanics of the human body, the heart or the lungs, which are in continuous movement, they are surrounded by a space in which there is fluid and which provide lubrication. So the important thing over here is, of course, the pleural fluid, which is present in the pleural cavity or in the pleural space. Uh, Normally, there is a very less amount of pleural fluid is present, and it is highly regulated. You can say the production and the absorption uh, is highly regulated. But sometimes what happened, this regulation is gone and the production is more or the absorption is less, and what will happen that it is going to collect, and we call it as pleural effusion. So whenever there is pleural effusion, the important uh, point which we are going to discuss today is like when a pleural effusion is like when there is excess of fluid in the pleural cavity, and of course like because that pleural effusion, it is going to cause trouble with the expansion of the lungs or with the breathing, so it can cause many signs and symptoms. So we call it as pleural effusion. It could be a hydrothorax in which like there is fluid in the thorax. It could be uh, hemothorax, it could be chylothorax or pyothorax, like the pus, things like this. So, to start with, you can see, for example, this is a patient who have pleural effusion, and what they are doing is they are taking, you can see like this is the lungs, and they are putting a needle to collect some fluid for the analysis, right? So, generally speaking, we classify this thing, pleural effusion. One thing is, of course, the types of pleural effusion. What kind of fluid is there? For example, it could be serous fluid, we call it as hydrothorax, or in case of blood, we call it as hemothorax. In case of chyme, we call it as chylothorax. In case of pus, we call it as empyema or pyothorax. But whenever there is pleural effusion or collection of extra fluid inside this pleural cavity, what happens is like, okay, that thing can be appreciated on X-ray. See in this X-ray that this costophrenic angle is visible, but here it is obliterated because there is a lot of fluid inside this lung. And see, like we cannot appreciate the hard border even. So of course, like this is a massive pleural effusion, by the way, because normally it is like very less. But of course, like just to show you, I take out this X-ray. Now, of course, like they put a needle and they take a little fluid just to see what kind of fluid is there, and we divide pleural effusion into two main categories. Whenever there is pleural effusion, we call it as either exudate or a transudate. So, in healthy people, there is a very small amount of fluid, but in pathological states, the excess fluid which can accumulate and which will lead to pleural effusion, accumulation of fluid within the pleural space. So when there is significant amount of volume which is detected clinically or on chest radiograph, as I show you, approximately 300 milliliter of fluid should be present so that it can be visible on chest radiograph. Because less than that, is not visible on chest radiograph. More than 300 ml is visible on chest radiograph. So basically we analyze that one. Why we analyze? Because uh, okay, when we remove that fluid, by the way, the one, you can say, one reason for removing is for analysis, and one reason could be therapeutic. Therapeutic means like to give relief to the patient. For example, if that fluid is too much collected, of course the lungs cannot expand properly and the patient maybe have some breathing difficulty. So of course in that case we should remove some of the fluid to give some symptomatic relief. So this is called as therapeutic uses of pleural tap, or we call it as pleural tap to take out fluid. Okay, this is called as what? Pleural tap. So what they are doing? They are doing pleural tap to take out fluid for analysis, for therapeutic reasons. So of course when it is causing some disturbance in the patient, like some breathing abnormalities or things like this, so you will remove a significant amount of fluid and the patient will be relieved of that symptom. So that is a therapeutic reason. Otherwise you will send it to the labs for analysis. That is like for diagnostic measures. So whenever we take out the fluid out, so we analyze it, and now this pleural effusion can be unilateral in just one, as I show you here, or it could be bilateral, like in both of the lungs, it can be present. So the first main point we establish clinically is either it is unilateral or it is bilateral, because unilateral are most commonly exudates and bilaterals are most commonly transudates. Okay, so transudates are mostly bilateral and exudates are mostly unilaterals. Okay, so it's a very important clinical point. Unilateral, think about exudate. Bilateral, think about transudate. So the thing is, if you see over here, transudates occur due to increased hydrostatic pressure or low plasma oncotic pressure. So you can say a generalized problem is there. For example, chronic congestive heart failure, cirrhosis, nephrotic syndrome, pulmonary embolism, or hypoalbuminemia. So whatever is there, either there is increased hydrostatic pressure or low plasma oncotic pressure, which will lead to bilateral pleural effusion. Exudative occurs due to inflammation and increased capillary permeability. So of course, like there is inflammation in the capillaries, which will make the capillaries more permeable, and the fluid is going to leak out. For example, in pneumonia, cancer, TB, viral infection, pulmonary embolism, as well as autoimmune conditions. Okay. Now, I will show you something very helpful thing. Whenever we analyze the pulmonary fluid, we use some criteria called as Light's criteria. Okay, this is the Light criteria for pulmonary pleural effusion. Okay, basically, whenever we go for pleural effusion, the first thing we see, whenever anyone have pleural effusion, and we take out the sample to send it to the lab, they test multiple things. For example, uh, wait. Okay. Wait. Okay. What they can check is they can check total protein, they can check the color, they can check the cells count. Okay. They can do culture and sensitivity. They can check the protein. So protein is already done. They can check the LDH levels. They can check the pH. They can see it under microscope, or what we can say cytological examination can be done. Okay, they can measure the glucose in the pleural fluid. They can check for rheumatoid factor, for example, because rheumatoid arthritis gives lung problems as well. And they can check amylase, and they can run a lot of other tests. Okay, I think these are enough. Why I'm mentioning these things, because the first thing, which we check in pleural effusion is the content of protein. For example, in exudates, the protein level either is equal to or is more than 30 gram per liter. And in transudates, it is mostly less than 30 gram per liter. Okay. So you can say the protein contents of the fluid or the pleural effusion is very, very, very helpful or useful, because when there is a clear clinical suspicion of either there is an exudate or a transudate, and we see like the protein concentration of the fluid is either higher than 30 or lower than 30, then we can infer that either it's a transudate or exudate, right? So, but sometimes you can say, sometimes this can mislead us. For example, uh, what if the value come back as 30? Of course, like this one is like either equal to or either it's more than 30, right? This one is less than 30. That's why they make a criteria called as lights criteria, and this one is very, very, very important, guys. Like it will you are studying here today, you will study this thing. I'm sure like you have done this thing in physiology, you will do this thing again in pathology, you will do this thing in internal medicine, you will do this thing in many, many, many places. See, the lights criteria says what they do, they check the protein ratio, the pleural protein versus serum. They check the ratio of LDH with the pleura and the serum, okay, in the patients. Now, a pleural effusion is likely to be an exudate if one or more of the following conditions are met. What I'm saying, a pleural effusion is likely to be an exudate if one or more of the following conditions are met. This ratio of pleural fluid protein with serum fluid protein, serum protein is more than 0.5, or if this ratio of LDH, like pleural LDH ratio serum LDH, is more than 0.6, okay, or the pleural LDH is more than the 2/3 upper limit of normal serum LDH. If one of the following condition is met, we call it as exudate. Okay. So this is called as Light's criteria. The common causes, guys, I already show you that photograph, and that one you can see. Remember that transudate is mostly a systemic type of problem, and exudate is mostly a localized type of problem. Like you can say infection is a local infection, malignancy like lung carcinoma, pancreatitis, again, pancreatitis is a local problem. So you can see over here, proteins are used to differentiate between exudate and transudate. LDH is used for same. Okay. We do, you can say, the gram staining with microscopy. Of course, why they do this thing? They do this thing to identify an infection. They check the pH. Why? Because it is low in empyema. Okay. We do a cytological examination to find out malignant cells. They check the glucose because glucose is decreased in many conditions like rheumatoid disease. Rheumatoid factor will be present in rheumatoid disease, and amylase will be high in pancreatitis. And color is very important. Why? Because in infections, the color will be opaque. In hemothorax, the color will be bloody. In malignancies, the color will be bloody, and so on and so forth. So, uh, very importantly, these are all the tests they can do for the pleural effusions. So, guys, remember this thing that the transudates are mostly associated with failures, heart failure, liver failure, kidney failure. Okay, and exudates are mostly due to infections, infarctions, or malignancies, or inflammation. So, see, it will cause inflammation. It is an infection. It is a malignancy. It is an inflammation. So all these things, right? So one of the things which I wanted to talk about is the color. Normal color is straw. Normally it's straw colored. Okay. Whenever it is yellow, it means it is infected. Whenever it is blood stain, think about malignancy or traumatic causes. Whenever there is pus, think about empyema, or the pus in the cavity. If you found food debris, maybe it is due to esophageal rupture, right? So this is how we analyze the pleural fluid. And of course, like a pleural effusion, whenever it is there, it point towards, you can say, further investigations. Okay. Of course, like anyone who will present with pleural effusion, like the first thing which we will do is like the pleural fluid analysis. And once the pleural fluid analysis is done, then based on the things we will get, either it's a transudate, which is mostly bilateral, or an exudate, which is mostly unilateral, it will guide us towards further investigation. For example, if it is transudate, you can do multiple investigations. If it will be exudate, you can do multiple investigations, or you can search about the causes. Now, of course, the important thing over here is simply uh, hypoalbuminemia. Like, of course, you will check the blood level of proteins. Now, why the protein level in the body is less? You will do the liver function test, you will do the renal function test, or you will do the renal biopsy, or you will do the liver biopsy. If you're suspecting due to clinical signs and symptoms and history that it seems like CHF or congestive heart failure, you will go for echocardiography, you will go to measure the BNP hormones, and so on and so forth. And same thing with this thing. If you are suspecting a malignancy, you will go for a CT scan, you will go for a biopsy. If you are suspecting a pancreatitis, you will check the serum amylase and lipase and all these levels. Okay, so pleural effusion will point towards certain condition and will require further diagnostic test, to reach the final diagnosis. And Light's criteria is very, very, very important thing. If you will open Kaplan, you will find they say like never, never, ever ignore these values. Remember them, memorize them. These are important. You have to memorize them. Quite easy to memorize, guys. Not hard, not difficult. And the concept is also easy. See, a exudate in which there is, you can say, there is inflammation going on, or the capillaries become leaky. So what will happen that simply whenever someone have exudate, okay, whenever someone have exudate, so they will be having the appearance of the CSF fluid will be cloudy, the specific gravity will be more. And now, due to leaky vessels, what will happen, like more and more proteins are going to leak out from the capillaries in the pleural fluid. So the protein content of this one will be high, or you can say more than 30 gram per liter, right? In this one, there is decreased oncotic and increased hydrostatic pressure. So generally, we will be expecting less amount of protein in the pleural fluid. So that's why, see, all this ratio is less, all this ratio is higher. And if you will talk about the LDH, which is present in almost every cell of the body, so in this one, there is inflammation, more and more cells will be destroyed, so more and more LDH will be there. But in this one, again, there is the problem with the oncotic pressure and the hydrostatic pressure, so the LDH will be less, right? So the concept is very, very easy. And by the way, these are not only the things which we measure in the CSF, or sorry, in the pleural fluid. We can measure a lot of other things, like they can also check the cholesterol content, for example. Okay, but again, this is like some basics which you must know, and like easy basics. Okay, so I hope you understand the slides criteria, what is the importance of that, and what is pleural fluid. I will see you in the next lecture.